All right, more health news you can use. Chiropractor Nekessa Remy is back with some exercises to help deal with nerve pain. Good morning. Good to see you.
Good to see you too, Bob.
So nerve pain, I mean, it covers so many areas that we're going to talk about. Let's start with those headaches that start at the back of the skull. That's associated with nerve pain, right?
That's right. So those are the headaches that are going to start almost at the base of the neck or the skull and travel up into the forehead or sometimes the side of the head. So what you want to do is you're going to massage that area. The best thing to do is you're going to use 2 fingers. We have these little bones at the back of our neck. We're going to start just below those on each side. And then from here, you're just going to tuck your chin down as you're pushing your fingers up against that muscle. That's going to relieve the muscle and ultimately help with the intensity of your headaches. So just like that.
Okay.
Now, if you're lucky enough to have tennis balls or massage balls, you can also use the massage balls to do the exact same thing. So whether you've got 1 or 2, I have 2, so I'm just going to place them in a sock like this, and you've got your little massage dome here. You're going to place that at the base of the skull as well. And then from here, lying down, all I'm going to do, tuck my chin down so that the balls are actually massaging and releasing the tension from those headaches.
And how often would you do that?
You know what? I would honestly do it 3 times a day, morning, afternoon, evening, for at least 60 seconds apiece.
Okay. And what's actually going on there, and how is that creating relief?
Yeah, so what happens is there are muscles at the base of the skull called your suboccipital muscles. It's like they actually form a little triangle. And through the triangle, you've got nerves that travel up. So when those muscles are tight, particularly because we're like this at a computer all day, those muscles get tight, will put pressure on the nerve and refer pain into the head.
Are you getting more of that in your clinic with our lifestyle these days and how we work?
Exactly. Thanks to COVID, I've been dealing a lot with what I call pandemic posture. So people are sitting for longer and longer periods, and that's resulting in headaches, back pain, sciatica, carpal tunnel. So all those nerve conditions that can be alleviated with exercise.
Well, let's talk about carpal tunnel. How do we relieve that?
So I want to make sure people understand that carpal tunnel isn't just wrist pain. Carpal tunnel is wrist pain plus numbness and tingling in the hands. You have to have the numbness and tingling in the hands in order for it to be carpal tunnel. But the thing about the carpal tunnel, which is right here, is there's a nerve that travels through. And that nerve starts here at your neck and ends in your hand. So a great way to relieve tension is to stretch the nerve. So you're going to start with your hand kind of like this, like you're holding a tray. Yep. We're going to extend the hand, and as we flex the wrist up, we're going to take our head and flex it away. And then we come back to our start position, extend, wrist goes up, and we bend our head in the opposite direction. So ultimately what we're doing here is we're clearing a pathway for the nerve so that it doesn't get pinched. Or if it is pinched, we're taking some of the pressure off by doing what's called nerve flossing. That's one. The other one that
nerve flossing?
Nerve flossing, yeah. So ultimately with nerve flossing.
See, when I floss, it gets on people's nerves. Do you want to do that right now? No, we don't have time.
But yeah, so this type of nerve flossing is going to help clear a pathway for the nerve. So when we get things like carpal tunnel, the nerve is being pressed by tendons, muscle, joints, all scar tissue sometimes. And when you floss, you're clearing a pathway, getting rid of the scar tissue, loosening up the muscles so the nerve is free and ultimately reducing your symptoms.
Okay, you mentioned sciatica, and that one, many people suffer from that, and it's frustrating too because that nerve pain reflects in all kinds of places, and it's hard to nail down and hard to relieve as well. What do you suggest? Exactly,
and the sciatic nerve is the same thing. It starts all the way in the back, and then will travel down the back of the leg to the foot. So almost 70% of Canadians suffer from sciatica, and I guarantee over the last 2 years that number has probably increased. So what you want to do is you're going to floss the nerve here. So again, I'm going to come onto my mat here. You're taking one knee up, so whatever the affected leg is, I'm going to bring it up, and then I'm going to straighten my knee. As I do that, I'm lifting my head off of the mat, and then bending, head goes down. So leg straight. Lift your head and shoulder blades off the mat, bend the knee, and come back down. So what I'm doing here is I'm flossing the nerve from my low back all the way down to the foot. And that's often where people will feel pain all that way. So doing this one will help to floss it. Now, if you don't want to get on a mat, that's okay. You can use a chair. And what we're going to do here, again, the affected leg, we're going to straighten it, pull our toes up towards us, And in this position, I'm going to bend forward, and then I'm going to bend my knee.
Dr. Nekessa Remy, hold that floss. We got to go, but we're going to link up all your socials and website at chch.com. Great advice as always.
Thank you for having me.